Hey, all you gritty nurses, we wanted to share an amazing opportunity for RPNs and PSWs in Ontario. Designed in partnership with the Government of Ontario, We RPN's Bridging Educational Grant and Nursing Program, also known as BEGIN, is a tuition reimbursement program for eligible students enrolled in bridging programs. So, what is BEGIN all about?
The program is designed for PSWs and RPNs looking to bridge to RN and RN roles and willing to commit to working Ontario's long-term care or home and community care sectors. After graduating, program participants agree to commit to a year of employment in either sector for every year or portion of a year. They receive BEGIN funding.
That sounds amazing. I've never heard of anything like that before. What can you get out of it?
PSW bridging to RPN can get up to $6,000 per year to cover tuition and mandatory fees for a maximum of $15,000 over 3 years. And RPN to RN or PSW to RN students can get up to $10,000 per year for a maximum of $30,000 over 3 years. The best part is, these are grants, so as long as you commit to postgraduate service agreement, you don't have to pay the money back. And there are other benefits.
Participants may also qualify for additional financial assistance while enrolled to help with costs such as caring for dependents, tutoring, and travel. BEGIN participants are paired with a dedicated case manager to support them on their journey in the program. They can also access free resources and support such as online NCLEX or REXPN exam prep courses, career counseling, resume support, and a dedicated job board.
Upon graduation, We RPN will connect BEGIN graduates to employment opportunities in the long-term care and home and community care sectors of Ontario, where they can make a huge difference. This can open doors for so many PSWs and RPNs.
I really want to learn more. What should I do next?
If you're interested, go to begin.werpn.com or email info@begin.werpn.com to learn about how BEGIN can provide you funding to expand your career and find meaningful work in Ontario's long-term care and home and community care sectors.
Hi and welcome everyone. Thank you so much for listening to us at the Gritty Nurse podcast. We're so excited to be here. You coming and listening week after week. We have great guests coming on today. And without further ado, I'm going to get Sarah to kind of introduce a little bit.
So it's been a while since we've had 4 people on the podcast. So we've got 2 of us today and we've got 2 guests coming on. Hopefully there's enough airtime for all of us. And I am going to do my best to attempt to introduce this podcast guest that we have today. We actually have Dr. Asif Doja. He's a pediatric neurologist, and Ali Hassan, who's a stand-up comedian and actor who's been on things like CBC's Laugh Out Loud, Designated Survivor, Goon, and they're each fascinated by what the other does. They have a podcast called Doctor versus Comedian, and in each episode, Asif picks a topic for Ali from comedy and entertainment and questions Ali about it. Then, Ali picks a topic from medicine and health and grills Asif on that topic. They talk about serious subjects in an unserious way. So if you like comedy, entertainment, health, and wellness, and you don't want to have to choose between them, then you should definitely listen to this show. And without further ado, I'm going to have them sort of introduce themselves, and maybe we'll start with Asif first.
Yeah, thanks so much, Sarah. You did such a good job. I think Ali's going to kick me off the podcast and ask you and Amy to be his new co-host. No, thanks so much. So I'm Dr. Asif Doja. As Sarah mentioned, I'm a pediatric neurologist in Ottawa, Canada.
Do you want to tell us a little bit more about yourself?
Oh,
Come on,
Asif, for the love of God. You're making us look terrible, huh? He is a robot. Put some emotion into it. Look, there's your sexy.
Oh my gosh, you guys have video and stills and everything. So yeah,
when that picture's from? That picture is from one year Asif put on a baseball hat. He put on a baseball hat and he went on Halloween as Tiger Woods. And I don't know if you can see it, but those were the Tiger Woods days. It was like the cheapest costume I've ever...
Did you know? Ali, like, it's a true story. I didn't have a beard. I dressed up as Tiger Woods for Halloween. It's true. It's true. When I was in medical school. So yeah, so I went to, speaking of medical school, I went to medical school at the University of Western Ontario. Then I did my residency in child neurology. So you can go directly into child neurology from medical school. So I did that at Sick Kids Hospital, which is in Toronto. I was there till 2005. And then I started in Ottawa. And I am currently the division head of neurology here in Ottawa. And then about 3 years ago, we started this podcast, which I guess we will get into.
Absolutely. And Ali, can you introduce yourself?
Yeah. Well, I started my medical training at the Comedy Works in Montreal. I am a doctor. I'm not a very good doctor. Many people have said that I'm barely a doctor at all, actually, is what they've said. The doctor of laughs is what we say on our podcast. I have been, I've had many different lives. I think I cobbled together about 5 or 6 jobs to make a nice living for my family. And luckily, it's all stuff that I enjoy. And it's stand-up comedy, and it's acting, and it's writing, podcasting. And I also teach at Queen's. I teach a stand-up comedy class. So it's kind of a full slate. Yeah, I would say that my passion really is, comedy and more broadly entertainment. I really like doing that. I always have enjoyed entertaining people. The goal once upon a time was food and entertainment. I really wanted to have a cooking show. That dream was killed by many people who didn't believe I should have that show, or just, factors beyond my control. But yeah, these days I work mostly as a stand-up comic. I work on the CBC as a radio show host, and I'm an actor on a few different things. And what you're showing right there is a scene from Run the Burbs, which is a sitcom on CBC television. And it's been wonderful. We've done 2 seasons, and my role has sort of increased on that show. And it's been a really terrific experience.
Amazing. Now, you must get this question a lot because Amie and I get asked this all the time. How did you guys meet? Yeah. And how did you come up with the idea for your podcast?
Well, how did we meet is not even we have nothing to do with that, do we?
So back in the day, our parents both immigrated to New Brunswick in the late 60s. As you could imagine, we're all people of color on this podcast today.
Right, yeah.
Not too many non-white people in New Brunswick in the late 60s in Canada. And so,
just to paint a picture for you and for our listeners, in 1970, my mother said that they used to have to, when they wanted yogurt, they had to drive to a farm to get it.
Wow.
That was the lay of the land in New Brunswick. Yogurt was too ethnic to be carried at the grocery store.
That's
it.
crazy.
Just want to add that a little bit. Yeah.
So I don't actually know how our parents, there was like a rumor that there was another brown person, and then is that what happened? I really don't know.
Something like that. Somebody told somebody that, oh, your father, my dad was an academic. He was, an English teacher and this kind of stuff. And then Asif's dad's an interesting guy because he's not an academic in the sense that he's an engineer, and yet he's still very much an academic as far as his interests go, as far as his book collection go. Very well read, very intelligent. I think it just seemed like a good match. Also, it was a beggars can't be choosers time.
Right.
You want to meet another brown person, you're going to have to travel a bit to go meet them. And I have this story that my dad used to always tell, like any time we saw anybody with a little bit of a tan, we'd be like, oh my God, one of ours,
yes.
Brown guy, one of ours, a Guyanese person, one of ours, Lebanese person, one of ours, white guy with a tan, one of ours, anybody with any skin color, you were like hard pressed to find anybody with those experiences. So they really gravitated towards each other, I think, in the international students department. Like when I see those pictures, it's very, very cool. It's like African students and brown students and Asian students hanging out together, and they're all like smoking and wearing bell-bottom jeans and mutton chop sideburns and stuff. I'm like, oh, you guys were part of something. I don't know if you were accepted, but your clothing certainly would have been.
Did you know my dad tells a story, and it wasn't my dad or your dad, but one of their friends, another Indian guy, South Asian guy, dated Anne Murray. Anne Murray, the Canadian singer.
Whoa,
Seriously, that's
small
intense.
Apparently.
And
I'm like, wow.
And the song Songbird is about that brown man. No, it's not. But imagine. Imagine.
I would have believed that.
Yeah, you almost got us.
So in sense, we like Ali is actually my oldest friend. He's older than me, FYI, 1 year older than me.
Okay.
So he's my oldest friend because I was born, and like, this is your friend. You have no choice in the matter. So
This is your other friend.
Yeah, whereas I had a choice. I was already friends with his older sister because she's a year older than me. So I already had a friend. I didn't really need Asif. And I let it be known to Asif that I didn't need him. And that's been the dynamic of our relationship ever since.
Oh my gosh, we can feel the energy and how much of a great relationship you both actually have, and I totally get it too, because back when I actually grew up in Rexdale, and so there were a lot of other, you know, ethnically, racially diverse folks, but still to this day, you get that sense where, you know, you walk into a room, especially within healthcare. I tend to be kind of a racialized and minority person. And, you know, you get that sense where you see that person across the room and you see the other ethnic person, you just kind of like give them the nod, like, yeah, you know, I see you, I recognize you. And I totally feel that because, you know, that's just, that has been our experiences and it's real. So I'm glad that you both connected, and that's kind of amazing. That's a really amazing backstory.
Yeah, and I was actually thinking as you told your story that I grew up in Hamilton, and there's what I call the Chinese restaurant circuit. So it's like, if you want to meet another Chinese person in Hamilton, go order Chinese food and get to know the owners, okay? Those are your new friends. And I was put through Chinese school where I was like, you know, like, this is your friend now, okay? So you guys better study hard and get good grades in Chinese school.
Study hard! Did you know how to play other instruments too? Like, I know that's
okay. What instrument do you think I played?
I have no idea.
Obviously.
Violin.
Piano.
No, piano.
It's so obvious. That was kind of like pushed upon me. So I did it for 7 years.
Piano, violin, those are your choices. You get two choices, and you get to choose one or the other, or both, I guess. Some people are piano and violin, right? Like,
Right.
Yeah.
Being like a clarinetist is like being an exotic dancer. It's like, get out. You're not even
It's
part
like,
of this family anymore.
a new instrument. It's like, if I knew anyone that played drums, I would be like amazed. But my choices were piano, violin. Somehow piano won out. It's not like it costs any less. So I don't know why.
Yeah, I know. And bringing a piano into an immigrant home, like a small apartment when you come, I mean, it's really like, it's not practical to start off with, but, you know, especially if you need to practice and all that, not a great idea. But you paint a very hilarious picture there. So I really like this idea of like, this is your friend now. And you're like, Henry, he's 63 years old and owns a Chinese restaurant. Yes, but he is your friend. That's how desperate we are for friends. Yeah.
That's so amazing. So you've both known each other for a very long time, and I'm imagining that, you know, the idea and the concept of having a podcast probably came about quite naturally, but maybe you can tell us a little bit about how the idea and the concept of your podcast came together.
Yeah, I mean, it's always been like Sarah said, we have this interest in each other's jobs. You know, Ali, he could talk about his interest in medicine and health in a second, and wellness, really. But I've always been interested when Ali got into stand-up comedy, which he did relatively later in life. How old were you? Like in your 30s, right?
34, yeah.
Yeah.
Wow.
So, you know, I was interested in that. We both love stand-up comedy. We used to watch Saturday Night Live as kids and talk about it when he'd come to visit us with his family. And you know, I saw Back to the Future with Ali. I saw, like, you know, probably the Goonies. You know, we've seen like all these seminal movies together when we were visiting. So E.T. we saw together in the movie theater.
Wow.
So, you know, we have this connection through entertainment. At least that's my interest, because I do medicine every day. So I'm more interested in something I don't do every day. So I'd ask Ali questions, and then when he started to get movie roles, I'm like, how was that? Oh, you were on set with like Eugene Levy. How was that? How'd that work? How'd you get that audition? And I would just end up asking questions, and I thought, well, this is pretty interesting. And then, you know, we have this opposite kind of thing with Ali and health, really.
Yeah, sort of. I definitely don't have the same level of interest in health as you have in entertainment. Let's relax.
Because he's saying I'm obsessed with entertainment. Like, I read Entertainment Weekly, the website. I mean, you know, my top 3 websites are all entertainment websites, not medicine websites. Right?
I'm not subscribing to the Canadian Journal of Medicine, right? That's not my Saturday. The way you are reading Entertainment Weekly, right?
Yeah, exactly.
I'm definitely interested in health, but I get interested in, and the reason Asif sort of underlined wellness is because I really get interested in this idea of, you know, is it Hippocrates who said, let food be thy medicine, let medicine be thy food, right? Nobody cares about that anymore, clearly. That guy's a castaway loser to most of you doctors. But I really like that idea about, because every doctor I've talked to will say something to the effect of, if I tell you I spent 2 weeks on nutrition, I might be exaggerating, right? That's what most of the doctors
like in
I know
medical
say.
school.
And in medical schools. Yeah, exactly. And to me, it's like you put food in your mouth 3 separate times a day. Right. That's something that is affecting your body. I don't understand. And then it's this weird thing of like, no, food doesn't matter. It doesn't matter what you put in your mouth. That doesn't matter. But here's a pill. Put this in your mouth and that'll go in your body. I'm like, what's going on? So most of the stuff that interests me is from that lens. Any opportunities to make fun of doctors, I'm on board with that. But then, it's like the cops. You can't make too much fun of the cops because one day you're going to need the cops. And then you're like, oh no, I hope they don't look up my last 6 YouTube videos about defund the police and all. So you got to have a little respect for doctors, because if something awful happens, I don't need anybody going, we have your number blacklisted.
we know what you talked about last week.
So basically that was the idea. Ali had started, he does a podcast with another one of his friends, Marco Timpano. And so it's called
This podcast is delicious. That's right.
Delicious. Yes. So he was already getting into the podcasting thing. And so we talked about, and I think the idea was this idea of us interviewing each other. That was kind of the unique aspect. And as soon as I kind of pitched that to Ali, he's like, yeah, that's it. Like I thought about some other things before that didn't quite pan out. And Ali's like, I think that's the concept. And so then, there's something that happened a couple of years ago. I don't know, there was a pandemic. I'm not sure. You guys did no, Ali's like, didn't happen. He's already blocked it completely.
I sailed through life like it didn't happen, yeah.
So the pandemic was bad in many, many ways. And again, we all know in healthcare the many things it's caused and is continuing to cause downstream effects, especially psychological, I think, still, and especially in our youth, the patients I see. But there was one good thing, which is the advent of A, some time on your hands, and B, Zoom and technology. You guys use Zencaster. These technologies and bandwidth on internet, it just all kind of came about. So suddenly what used to be very difficult was very easy now to do a podcast. And Ali and I live 4 hours away. So how are we going to do something together? That's basically the impetus. So we had some time, we had the technology, and it all kind of came together. So it was actually in 2021 that we started doing the podcast. So that's I was going to say the short story. That was not a short story at all.
It's not. I mean, it's not short, but you actually left something else out in your semi-short story. You're forgetting about the point. We didn't know what the podcast would be. He's very interested in podcasting. I already had a podcast. The show that I have on CBC Radio is called Laugh Out Loud. That exists also as a podcast. So I was in that world, and he was like, I want to have a podcast. And I was like, okay, sure. And he's like, I just don't know what it's going to be about yet. I'm like, well, good luck with that. And he's like, oh, we should do something. But it was at a cottage once. Our families were at a cottage, and Asif's wife is listening to us chat in a very engaged way in the kitchen of this cottage, and taking a huge interest in each other's experiences. And she was just like, guys, this is it. This is what the podcast should be. And we were like, this? No, this is just us talking. You don't understand. This can't be a podcast. This is just us having a conversation about things and she was like, yeah, this should actually be it. And then Asif was like, yeah, maybe onto something. And I think that really put us in the direction of creating this podcast, right?
Yeah, I think that speaks to two really cool things. Like, I think the whole evolution of how that came about is amazing. And the whole part of having a conversation, that's kind of how we started our podcast too. I think when you captivate listeners through creating stories, and if you're just talking and it's just a natural conversation, that's how you pull people in. And then the second point is your wife is right. And that means you should listen to her more often.
Yeah.
It brings up a third point, yes, where I remembered the words of your wife and you didn't. It also brings up that.
Oh my gosh. Okay. I really want them to listen to the Great Nerds podcast, but this episode, just skip over. Just skip over this one episode.
We'll look for all the various tags and add them in.
Oh no.
And another question Amy and I get all the time is how do you come up with your ideas? And we kind of come up with them together, I would say, but it sounds like you guys maybe volunteer each other what to talk about. So I want to know what that creative process, who tells what you're going to, or who tells who what you're going to talk about?
I don't know. I mean, I think Asif probably has. Asif does the majority of work in this podcast. Without Asif, this podcast cannot exist. I have to give him full respect for, when do you want to pre-discuss? When do you want to record? Can we set our next 7 dates for recording? Can we do this? So I really need that. I need somebody with structure. So we complement each other very well. And then I think, both of us are kind of, I assume Asif enjoys what he's doing here, but I think I can speak for both of us when I say we are both enjoying this podcast to the level where things just sort of come out and speak to you, you know, like, for example, the other day, I'm listening to an episode of a podcast called Smartless. Jason Bateman, Will Arnett, Sean Hayes have this podcast, and they're interviewing Keanu Reeves. And Keanu Reeves is talking about how he had to change his name. He was asked to change his name when he first started in Hollywood. And I start thinking about my friend Fuad, who was told that with his name Fuad, he'll never get anywhere. So he became Gabe Gray for many years and then recently came back. And so I'm sort of thinking that might be an interesting topic for us to talk about entertainment, people who have to change their names. And, you know, our first introduction to that was John Mellencamp. Hey, Asif. And then John Cougar Mellencamp. And John Cougar, you see him go backwards into himself. Yeah, he started John Cougar. And then, but there's plenty of examples of that, obviously, in Hollywood. And it speaks to a broader thing of what you think you have to do to make it and what Hollywood will accept and not accept, or what they think they can accept or not accept. So it's just like immediately it feels like an exciting conversation. And as far as the medical thing goes, often we'll try to tie it in some way. That particular one that I just mentioned wouldn't be tieable. So then Asif will just pick up one of the many numerous list of, increasing diseases that are out there or conditions that are out there. We're never at a loss, you know.
Or that people have asked us about, right? So we get some listener, just like you guys, I'm sure, listener submissions. And of course, that means something people want to talk about. And then, of course, there'll be things that are in the news, right? So sometimes it's sad when a celebrity dies or passes away, especially if they were big in comedy, like when Betty White passed away. We'll do an episode on her, and other things that have been in the news lately. So a couple months ago, everybody's talking about the Nepo baby craze, like Nepo babies in Hollywood, and so we talked about that. And then at the same time, people are talking about Ozempic, right, as a weight loss drug. So people want to know, what is it, what's it actually indicated for. So those are just sort of things that will come up. So it's often our interest, it's what's in the news and what listeners have kind of asked about.
I think that's my favorite, when something organically presents itself in entertainment and in medicine. You can't sort of create but for example, Bruce Willis, right? We have a number of different actors who are suffering from a variety of things. And what was Bruce Willis? I feel so stupid. What was he?
So he had aphasia, which is difficulty finding the right words. Which we just saw a good example of right there.
And that is me doing a meta sketch here, and you were perfectly engaged. It's a weird thing to say. It was perfect. Bruce Willis has aphasia. Amazing. It is not amazing. It is awful, but it gives us an opportunity to highlight somebody's work and their career, and also highlight something that most people, and I usually speak on behalf of most people will not know what aphasia is. I only knew it because we have one friend who's a speech therapist who worked with people with aphasia, and she had explained it to me. I had long forgot what she explained to me. That was many years ago, but I knew the name aphasia. And so, we hope that we feel like we're generally talking to a non-medical audience and somebody who's not as much of an entertainment nerd as Asif. And I feel like there's a lot of people who get a fair amount out of listening. And our listener feedback is really great.
That's really amazing to hear. And I think that, we enjoy that aspect too. I think making sure that it's timely. So, you have information that is relevant to individuals, and then that pulling in that medical piece, because there's a lot of questions and there's a lot of misinformation. And I'm sure you've seen it all out there. And it's really great that, you could put that comedic spin on it, but also bring in that needed medical information from, a trusted healthcare professional.
Yeah, absolutely. I think it's just kind of how Amie and I come up with topics too. It's like current events, what we think is trending, what people suggest to us. When we get pitches for guests to come into the podcast, we think, is this something that our listeners would want to hear about? And even though I feel like we started out with nurses, it's really broad as well. So when I speak about certain issues, I try not to get too far into the weeds, because I think I'm going to lose people, like I lose myself half the time. So
pull it in, Sarah.
I have a really short attention span. You might not know this about me, but I do. And so if I feel like I'm getting bored, I'm like, I know my listeners are getting bored. So we kind of keep things fresh.
Yeah. We also want to ask you both about your favorite episodes. Just like you asked us, could you tell us one of your favorite, your top episodes? Each one of you.
And let's start with Asif.
Yes.
So I'm going to pick one. I'll pick our non-interviews, but we can talk about interviews. We have, done a lot of interviews. Sometimes you guys gave us ideas for people. We're like, oh, we should interview that person. So we've asked them after hearing them on your show. The one that comes to mind the most is the one we did about women's pain. So I think we were talking about Ms. Marvel, the Marvel show, but that's a show about female empowerment. But this idea of women's pain came from a listener, and a listener basically said, can you talk about how men and women's pain is treated differently in the healthcare system? And I honestly thought, I don't know if there's a lot of stuff there, but they're asking, so let me look it up. And there is over 20 years of information. You guys probably know this, but I wasn't aware of it, of data on this. It's not a new phenomenon at all. And women's pain is treated differently than men's, as in it's dismissed more, treated with less intense medications, non-medications. Like, oh, you don't need medicine for this, whereas men's pain is. And it was so eye-opening to me. And I would say humbling. It really made me think that, there is so much more to learn. And if you just listen to people, in this case, it was listening to a listener who is obviously, they weren't angry at us for not covering it. It was just a suggestion. So we thanked them on our podcast and said how much we appreciate it. So that type of thing is a great example of how, at least personally, I can learn and improve my self as a physician just through the podcast. So that's the example I often use.
That's amazing. I think it's such an important aspect. I think we've touched on it many times. I think we had an episode with Dr. Alika LaFontaine talking about pain and about the whole idea and the concept behind pain is what the patient says it is, but seeing that doesn't necessarily translate into medicine. And then also just we talked also about the racialized aspect where some folks might be considered drug seeking or that they might be considered, there's all sorts of different things in relation to how other individuals are treated in relation to pain. And I think that might be something else you want to examine too, that racialized aspect, because it's huge where we, even myself, had experienced instances where I didn't get treated the way that I should have been. So yeah.
And how about you, Ali? What's your favorite episode?
Well, as I said, I do like episodes that have a nice link between medicine and entertainment. And then there's another element, too, that I really like. So, for example, we did an episode on Chris Helmsworth. We as a family, we were watching a show. What's the name of that show again, Asif? God damn it, I'm really aphasia-ing it today in a huge way here.
Yeah, of course, I'm forgetting.
It's called Limitless. It's called Limitless. It's called Limitless.
On Disney Plus, right.
And we're watching Limitless as a family. And in one of the episodes, so Chris Helmsworth, Thor, who plays Thor, pushing his own personal limits. And in one episode, he finds out, courtesy of this doctor, Dr. Peter Attia, who's a longevity specialist who's helping him push his body to certain limits, finds out that he has this pretty rare genetic makeup which predisposes him to Alzheimer's disease. I'm getting a nod from Asif. I said nothing incorrect there.
That's true.
And so it was very interesting to talk about that. Now, that's pretty rare. Still, I found that interesting. The episode that really comes to mind for me that I thought was great from a number of perspectives, Asif and I both fans of Chadwick Boseman. One of the first times I kind of chilled out with my wife, at my house, I rented 42. This is the back in the days of rentals. I don't know if you remember rentals, but we
yes,
rented
we know.
The Jackie Robinson film. And I just remember being like, who is this guy? Who is this guy? This is amazing. I was like, am I watching a movie or is this a documentary or what is that? Like, he really transcended that character. And so then to see him again over the years, I was like, oh yeah, it's that dude. And then there's Black Panther, obviously. He died of colon cancer. There was a sadness about it, which I think both Asif and I felt that he had to hide that, not tell it. His people closest to him in his life did not know about it. He didn't want to be pitied or labeled or whatever it was. We still don't understand the intentions behind it. And so it was nice to talk about colon cancer for people who are not aware of it. Nice to talk about his life. But then there's another element, which is now Asif gets to talk about who should be screening for colon cancer, why it's important. So then there's this beneficial element. It's not just informative. It's also like, here's something tangible that you can do and you should do if you're particularly a male over this certain age and this kind of stuff. So I like that. I like, it's one thing if your doctor goes, and make sure you get screened, and you leave their office going, yeah, whatever, pervert. I know you weren't really want to stick your finger in them, right? But it's different when a doctor that has no agenda and somebody who you get to sort of enjoy their company almost in a friendly way through a podcast, they tell you something. I don't know. I really like that episode. Hit on many levels for me, and I think for Asif as well. So I always think of that one as one of my favorites.
And a similar one, we interviewed Biff Naked, so the alternative rock superstar, right, Canadian, and there was, I mean, just a super amazing talk. She is such a great person, so generous with her time, but she's a breast cancer survivor, and so it was Breast Cancer Awareness Month. So the next week we kind of divided up the episode. So one was the interview with her, that was the entertainment part. The next week, we did a deep dive into breast cancer. Again, something that people don't always pay attention to, and the awareness of who should be screened, when should we be screening, should we be screening earlier? It's a big push for a lot of breast cancer survivors to advocate for earlier screening. So again, it's tying these things together, and in a way that we think we're actually educating ourselves and other people.
Yeah, no, I think that's actually amazing. And I think we actually, I had a little bit of a mini campaign myself because I suffer from IBS, where I was talking about my own experience having to get a colonoscopy, because there is a lot of fear within, Black communities in relation to, colon care. I think there's been some things that I heard within my own community and my own cultural backgrounds, just that fear around testing. And it's definitely a huge conversation that we need to continue to have, so, racialized folks can, be aware of what can occur, right? I think it's having that opportunity to go on Twitter and just talk about all things anal or bum kind of took the mickey out of myself, but also gave people an opportunity to share their stories with me too. So I think that, these things that we consider to be taboo, we need to remove that by having these conversations. So thank you for having that conversation, because it's hugely impactful for my community as well.
I think it's just making content more relevant, right? Mm-hmm. So if someone were to see the topic, like, what do Chadwick Boseman and colon cancer have in common? It's almost like the entertainment part is the hook, and then you can get people listening and then talk about what really matters. Like, why should you care about colon cancer? Why should you get screened? Like, this affects a lot of people on different levels. So I really like that idea.
Yeah, I mean, I don't know if we intended it to sort of hook people in. It wasn't like a draw product or anything. We'll get them with the Chadwick. We'll keep them with the cancer. It didn't start that way. But I think in the end, you're kind of right that that's the way it sort of lands. I'm okay with that. Like, I think there's huge benefit for the people listening, and based on what they're hearing and what they can take away. And also with things like this type of testing, Amy, you talk about like certain communities have these biases or whatever you want to call them, like these negative outlooks on these things. Sometimes you got to chip away, right? It's not going to be one person saying one thing. So sometimes Asif and I might just be putting just one more brick in the wall towards somebody finally going, okay, that's the last straw.
Yeah.
I heard this person say it, this person say it. My friend got tested once. Okay. And I know that's the way I operate as a human being. I put things off, and then suddenly it gets to a point where you're like, well, I can't really put this off anymore. Yeah, like I've been knowing for a long time that I should cut back on my drinking, and then just like one conversation and another person says something and everything, and then I'm just like, and my wife does the math. She goes, I think you're drinking about 100 drinks a month, and you're supposed to have 2 a week. So maybe, and I'm like, okay, that affects a little bit. This affects a little bit, and then finally you go, okay, it's time to just put a stop to all this, right? And I know there's plenty of people like me who don't put the brakes on immediately like they should. So I think it's all a service in the end.
Well, I mean, it's all about having these conversations. And I think you kind of talked about it perfectly, that just every single conversation we have, particularly whether it's about health, whether it's about comedy or entertainment, if we're trying to send a message, as long as everyone's talking about it, we are chipping away at those layers. And eventually, people will make change. So I think that's actually hugely impactful. And I love that. I'm going to steal it. It's mine. It's fine. Before we wrap up, we have 2 really great questions just to end the episode. First and foremost, to Asif, what is the hottest topic for you in healthcare right now?
The hottest topic in healthcare, I think it is something that you guys I know talk about all the time on the podcast, and it's all interrelated. It's the wellness, burnout, and the workforce issues. They're all, of course, so interrelated. It's so important that we address these issues. I think we're seeing it. We're seeing it with nurses. We're seeing it with physicians. I think we're at a crisis point. Was it caused by COVID? I don't know if it was caused by COVID, but COVID certainly elaborated this issue that's going on and brought it to the forefront. I wish, we're trying to sound the alarm. I know you guys are in nursing. Really, it's at a crisis point, and we saw it, how stretched we were in pediatrics in the winter with all the flu season. And so, I think that is the main thing we really need to be talking about. So it's funny, Eric, because it's not disease specific. It's not a disease. It's not, we got to increase screening. We got to fight this virus. It's actually the workforce. And if we don't do something now, there are going to be, unfortunately, severe consequences, because we just will not physically have the people to deal with these issues. And it's so interesting. I'll tell you a story, Amy, you don't know this. Our podcasts have been intertwined for such a long time, because Ali said he ran into you guys at, what you guys at a podcast convention?
PodCamp
PodCamp.
Toronto. Yeah, it was a
he ran into
podcasting.
you guys, and then around the same time, I got a call from Ottawa. I got an email from Ottawa Morning. They're like, "Oh, we just announced the new budget. The federal government just announced the new budget. Would you be interested in coming on to discuss the ramification of the budget?" And the reason I'm bringing this up is, of course, because the federal government is putting money in to provinces to help with healthcare. But how that money gets spent, the devil's in the details. I'm like, oh, that's the message I want to get across. But I was too late. It was at the end of the day. And then as Ali, and I'm sure Amie and Sara know, the news cycle is very quick. So they emailed me at 8 in the morning. I go back to the 4. They're like, I'm so sorry. We already found somebody, but we'll let us know next time. So, of course, I tuned in the next morning. I'm like, oh, who are the experts they got in? And Ali, do you know who one of the experts was?
Was it Amy? Was it Sarah? Yeah, okay.
It was Amy.
Yeah.
I'm like, oh, it's Amy. And of course, Amy echoed. And of course, the other person was the Canadian Medical Association president, who they just mentioned, Alika Lafontaine. So I'm like, wow, you asked me before the head of the Canadian Medical Association? I'm so honored that they asked me to be on it. But anyway, you and Dr. Lafontaine spoke to this, right? Which is, it's the devil's in the details. How is this money going to be spent? And their priority really needs to be spent on the workforce, improving salaries, for example, for nurses. How do we retain people and recruit people? So that's my, again, a long answer about that. With a little anecdote.
I love it.
Amy and Ali.
Ali, no pressure. What is the hottest topic in comedy right now?
I think it's a topic. It's a thing that transcends comedy, as you well know, and it's storytelling, and it's authentic storytelling. I was listening to a podcast with Jay Leno, and Jay Leno, not everybody knows this, but an absolute enormous machine of a stand-up comedian. Before he had a late night talk show, before anything, he was already very, very wealthy just as a stand-up comedian. He was a really incredibly good stand-up comedian. And his, theory has always been write joke, tell joke, get check, right? That's just keep it as simple as possible, economize, quick jokes. So he's really bam, bam. He wants a laugh every 6 to 9 seconds on stage. And so guys like that, these are old school purists, they probably don't see value in storytelling as comedy, but storytelling. And, podcasters, the reason it's so popular right now is because so many people are telling incredible stories, whatever it is. And they have various levels of entertainment and information. I personally think that when you can tell a story with comedy in it, you can make something that's potentially very serious, very compelling, and very digestible. So for me, and who knows how long this will last. We could have it another 5 years. Remember that time when everyone was telling their goddamn stories? I'm so happy we're going back to 5-second jokes, boom, boom, rat-a-tat, who knows? But right now, because you're asking me about something that's timely, this wasn't always the case. I think storytelling in comedy, and authentic storytelling in particular, is particularly hot right now.
Yeah, no, that's amazing to hear. And I think that, we do need to have comedians that are refreshing. And I think sometimes we get bogged down in the politics and the weeds. I'm sure you probably have an idea of what I'm talking about specifically.
Yeah, of course.
And, but I think that, we do need to see that authentic storytelling and to really make it light again. I want to enjoy comedy where it doesn't have to be overly political and we don't have to use our fists.
Oh my God.
But thank you.
I love it.
I can't even wrap up.
Oh God. Okay. All right. Thank you guys so much for coming on to the Gritty Nerds podcast. Do you want to tell our listeners where they can find you?
Yeah, for sure. We're Doctor versus Comedian. You can find us on our website. We're on every place you get podcasts, Apple Podcasts, Spotify, or you can reach out to us at Dr. B Comedian, Twitter, Facebook, Instagram. Just give us a follow and check it out. We even have an interview, of course, as you guys said, with you guys a few episodes ago. So this was the reciprocal podcast, and we just love hanging out with you guys. We have such a great time with you guys.
Thank you, Ali and Asif, for coming on to the Gritty Nerds podcast.